Doctors of Reddit, what is your worst case of I googled my symptoms? I had a grade school kid tell me he had a brain tumor. Turns out he put a dried bean in his ear and forgot about it. The kid was 9 or 10, so no stupider than your average 9 or 10-year-old. He didn't really have a reason why, but they'd been using beans for some counting thing in math at school. I don't know what kind of bean, it was small and red. It came out with tweezers. This was years ago and he has probably forgotten all about it. Unless his mom reminds him periodically, I would. Serious answer. I try to ask my patients if they have Googled their symptoms. It gives me a lot of information about what they are worried about. I then try to stay humble about the findings, and try to not be a jerk about that. Trust is not built by telling people they are stupid. However, it is hard to keep a straight face when a 50-year-old male walks in and says I think I have caught the Down syndrome, or when a young woman thought she had testicular cancer. Not a doctor, but I had a coworker come into the office with this one. He was having nausea, fatigue, frequent urination and decided to WebMD that shit. We're chatting in the office one day and he says something like, yeah, I've been feeling like shit lately, and it sounds like gestational diabetes, but I can't find any cases of men getting it. I just slowly lowered my head into my hand and asked him, do you even know what gestational means? He did not. Paramedic student here. Last week we had a call for an imminent delivery. PT started having abdominal pain that would last a little bit and stop, and about 2 to 3 minutes later would start again. She googled her symptoms and everything she found was saying she was in labor. She called her husband and he told her to call 911. We walked in as the baby was crowning. She had no idea she was pregnant. Not a doctor, but when my fiancé said he was having chest pains and when he breathed, it crackled. I googled and all of the symptoms lead to serious illnesses such as a collapsed lung. Thought nothing of it. Diagnosed it ourselves as an allergy and didn't go to a doctor till later in the day. It was in fact a fully deflated collapsed lung. Not a doctor, but worked at a hospital for a while. One of our doctors came back to the nurses' station laughing because someone was fully convinced they were diabetic because they were craving water, and WebMD said that makes them diabetic. Turns out they are just human and require it to live. Actually, I'm a doctor, but this story is from medical school. I had a patient who correctly diagnosed herself with mastitis, although she was very worried that she had inflammatory carcinoma of the breasts. To be fair, they can look similar. Another time, I had a patient correctly diagnose a lump in her breast as a fibroadenoma. I was very impressed. Ah yes, drive. PM me your lovely boobs. I've heard of your work. I'm not a doctor, but I'm a medical assistant and I room patients for the doctor. This is in the occupational health field, and we had a young gentleman come in who was pretty sure he had a groin hernia according to his Google search. He said he'd been lifting produce crates and experienced sharp, overwhelming pain in his groin. The doctor came back out after seeing him and was clearly fighting laughter by the time he got to the desk. Turns out the kid had chlamydia, which had caused things to become swollen, and just happened to get symptomatic while he was at work. Not a doctor, but in 2013 I was feeling awful, shaking, puking, dry heaving, shaking, excruciating and debilitating pain. Went to the ER, had blood work done that I never knew what it said, and the doctor told me it was a gallbladder attack. Gave me pain meds and sent me home. 3 days later I was even worse. Couldn't eat, couldn't sleep. The only relief I felt was when I was in scalding hot bath. I finally went back to the ER and they did more blood work and told me my gallbladder was septic and my pancreatic enzymes were 6,500 and rising. They should have only been 100 to 150 and I was dying. I was admitted, and when they did my gallbladder removal, my gallbladder was solid black and had 80 stones and a tar-like substance from sepsis. Come to find out, the first time I went to the ER my enzymes were 2,000. I should never have been allowed to leave the hospital. Not a doctor, but I deal with migraines. I would not be surprised if someone experienced a migraine for the first time, googled their symptoms while they still had the clarity to do so, and went to the ER thinking they are having a stroke. I had a stroke and thought it was a migraine, so this problem totally goes both ways. Had a patient come in and tell us she is having vision issues that are new. Okay, let's have a look. Oh, looks like you placed a contact over a contact 27 times. I had a UTI. Because I had the symptoms and Googled it. Day of doctor appointment. It was just a regular checkup, but I asked for a UTI test since I explained how I was feeling. Conversation went like this. Could it be possible to request a UTI testing? I've been feeling the symptoms of burning when I pee and some discomfort. How do you feel now? Any pain? Well, no, not at the. Well, if you did have a UTI, the symptoms wouldn't go away, you are fine. 2 or so days later I get a full-blown kidney infection from a. Who would have guessed? A UTI. Sent out a complaint. Screw that bitch doctor. I always ask for a test if I am suspicious of anything, and I have them document it if they say no from now on. That was a horrible experience. My brother is both the doctor and the patient in my story. Around 2 months ago he had started to feel really tired and ill. Like really ill. He had said to his partner that he felt like he had leukemia, which was of course just kind of shrugged off because why, how would he have leukemia? He had been suffering with a throat infection for a few weeks and was given antibiotics by a GP at his practice. After a week or so it hadn't helped and he was tired and slightly breathless whilst walking the dog one Sunday afternoon. The next morning he registered himself as a patient and took his own bloods after being prompted by his receptionist, parents, doctor friend, and sent them for testing. Unfortunately he had been completely correct, and when his results returned he saw that he did have leukemia, acute myeloid leukemia to be precise. He saw the results and knew immediately. As he went to confirm them with the GP next door, the specialist hospital had already called and asked for the patient to be brought into hospital immediately. Unfortunately his hemoglobin levels and general cell count were so low and he was in a really bad way. Many transfusions and 1 round of chemotherapy down, and he is determined to beat this horrible disease. There's a long way to go, but he won't give up, and neither will we. I love that guy so much and wish I could trade places with him. There's potential that I may be used as his bone marrow donor. I hope I can be, because anything I can do to help, I want to do. It's not too likely to be me, but I feel so helpless right now, so it would be good to help, I guess. Anyways, no Google, but turns out these doctor guys are pretty damn good at their jobs, even when it's certainly not their specialism. This confuses the hell out of me. When I go to a doctor they specifically ask if I've done research about whatever, like they expect it. Awkward position, cause if I have researched I feel like an idiot using Dr. Google and having medical student syndrome. If I haven't researched I get the distinct impression niece disappointed the doc. Med student here. There is a spectrum of acceptable Googling. It is helpful if a patient has some sort of idea what might be ailing them. They know their body best, and often it gets the gears churning for the physician for possible differential diagnoses. However, if said patient comes in knowing they have a rare disease because of common symptom X and disputes everything the doc says despite negative tests, that's when shit gets annoying. Ever since we studied multiple sclerosis in neuro, I'm convinced I have it. Despite my only symptom being paresthesis, funny feels in my legs at night. If your legs just feel weird at night and you have literally no other symptom, it's more than likely just restless leg syndrome. It can feel like an ache or pins and needles, and makes you feel like you need to move, but moving doesn't actually help. Usually happens at night or early in the morning. It's pretty common. Not a doctor, but my friend once said a guy came with a backache and wanted to get operated because he thought he had kidney failure. Not a doctor, but throughout my childhood and teen years I had these weird episodes where I would suddenly have really bad déjà vu and get very nauseous. For the next few hours afterward I would feel like I was in a fog and my memory would be shit. Eventually I googled my symptoms and learned they might be minor epileptic seizures. I went to a doctor and he laughed it off and told me it was probably just having panic attacks related to the normal emotions of being a teenager. I was so sure he was wrong that I opted to go get an EEG. Turns out I have a mild form of epilepsy and Google was totally right. Not a doctor, but the brother of the patient. And worst being on the money. My older sister diagnosed herself as having symptoms of systematic heart failure. Her new primary doctor agreed and gave her some basic guidelines of what to do, and had her visit her cardiologist. The cardiologist poo-pooed her, saying there was probably nothing to worry about, and scheduled a test in a few days just to be on the safe side. One of the things her primary had her looking out for was sudden weight gain, and when she woke up 2 days later suddenly 6 pounds heavier, we went straight to the emergency room, who ran tests. including an echocardiogram. Her injection fraction was 12, and they immediately sent her to the biggest hospital in the area, where they ended up saving her life from congestive heart failure. She had had at least 2 silent heart attacks due to the amount of damage they found. Not a doctor, but I was having horrible debilitating headaches for a while. Googled my symptoms and they ranged from stress to brain cancer. Ended up being sinusitis. Not a doctor. I had an insect bite basically next to my nipple. It was itching like crazy, and my usual bite cream said not to be used on nipples. So I decided to Google what else I could do to relieve it. Found out that apparently no one else has ever had an insect bite on their nipple, but that what looks like an insect bite on or right next to your nipple is almost certainly inflammatory breast cancer. Phoned up my GP. We used to be neighbors, so I kind of knew him and was in a right state because I thought I had this incredibly aggressive form of breast cancer. He listened to me for a minute, asked a couple of questions and then said, "It's an insect bite. Come back to me if it's still there in 3 weeks. Oh, and try deodorant on it." The deodorant calmed it right down, and it had gone by about 5 days afterwards. Oh man, one time when I was a teenager, I worked myself up into a panic because I had red splotches on my neck and a killer headache. I didn't know what it could be. Cancer maybe. My best friend had died of an undiagnosed brain tumor a couple years prior, so I was terrified. I went to my mother, a doctor, and she looked over me carefully. Then she licked her thumb and rubbed away the spots. They were just spatters of fruit juice. Not really related to this topic, but I am a medical student, and recently got sty in my eye. Sty is usually self-diagnosable, but I called up my cousin who is a doctor just to confirm. Anyways, when I was telling this incident to one of my friends, he started scolding me, saying as a medical professional, I should set the example of going to the doctor and getting proper medicines and treatment, and all I could say was, "Dude, I'm becoming a doc." I know how doctors are doctors, especially when they know you're a medical student, tend to overdiagnose or pretend as if we have medical student syndrome. But anyways, got the meds and my eye's healing. Not a doctor. When I talk to doctors I say Google told me blah blah blah. Is that accurate? Usually helps establish that I've tried to do research but trust them more than Google. Daughter said she was worried about her medicine because she read on the bottle it causes Down syndrome. I told her you must have misread, and she cut me off because she was sure of it. Get home and read the bottle. May cause drowsiness. Not a doctor. Nor was my brother, despite him thinking his Google skill is a degree. But a couple years ago my brother decided that since I had been laid off and needed to borrow some money from him to tide me over, that it meant that I was utterly depressed and suicidal. Thus, he deduced that I needed to be institutionalized and took me to a doctor. He lied and said he wanted me to just get a normal checkup since I hadn't had one in a while. I was, I believe, rightly pissed off and embarrassed, but since I needed the money I went along with it. So he decides to just come into the psychiatrist's office with me while she is trying to ask me some questions and see how I am. He starts throwing out terms like maladaptive coping and how I am suicidal and needed treatment. She finally tells him to leave and I speak with her for a bit. Now I was a bit morose because I had lost my job and was embarrassed about asking for help, but I wasn't suicidal, and the psychiatrist agreed, stating that I just needed support and not Google quackery. I hadn't turned to drugs, stealing or any other illegal or destruction activities to deal with my depression, just that I was a bit withdrawn and down because of my recent low. I had 2 separate doctors tell me that I was having panic attacks, when in fact I was having simple partial seizures caused by a Lyme-sized cancerous tumor in my brain. I got so much Xanax though. The healthcare system where I live is broken. Someone I know didn't have a doctor, had been looking for one for 7 years and started having worrisome symptoms. The ER clinics wouldn't order tests because follow-up appointments would be needed, and they didn't do that. She finally went to an ER and stood her ground, saying she wasn't leaving until they did tests. Google suggested she had a brain tumor or a hyperactive thyroid. They reluctantly did the tests and she had to fight for the follow-up. Turns out it was a thyroid disorder, for which she was in bad need of treatment. Without Google, she didn't have much ammunition for the fight. I went to a doctor one time and he Googled my question in front of me. Being a software developer, I don't find this shocking. It still takes some skill to Google exactly the right thing. judge the results' reliability, and interpret them right. At the hospital in my town there was a kid who came in saying he had knee pains. The doctor said it was from playing basketball, and 5 months later at a different hospital they found that he had knee cancer and it was too late to treat him. He died a few weeks later. Really sad story. I'm not a doctor, but I went to a doctor because I was certain I had delayed sleep phase disorder. He told me I couldn't have a sleeping disorder without being depressed and made me take a depression test. It said I wasn't depressed, so he said obviously I don't have a sleeping disorder. I went to a sleep specialist a few months later and they diagnosed me with delayed sleep phase disorder and helped me get it under control.